every day to help people stay healthy, to make sure that if they need care, they get care, and that it's affordable. And it just feels like right now in our country, all of that is being torn apart, and I am really concerned. So I wanted to be here today to hear from some experts to talk about what you see is happening so that we can make sure, as I go back to Washington, D.C., I can help inform other people of the realities on the ground. Trump just had an unhinged press conference talking about, women's health and everything from Tylenol to God knows what. I'm surprised he didn't go after coffee, but it was just terrible to watch because people do really count on science-based information to make sure they are making their right healthcare choices. So I say to anybody who watched that or listened, talk to your doctor, talk to your expert. Don't listen to somebody who was telling us to inject bleach during COVID. We need to listen to our experts, and that's really critical. I am deeply concerned about RFK Jr. running HHS. I obviously did not support him when he was nominated and went through the Senate, but he is really leading the charge against public health. He fired all of our vaccine experts off the panel that makes the decisions about what is best for us and put in his own anti-vaxxers on that board, and we're now seeing the result of that, where they are coming out with telling people to delay vaccines, giving new information out that is not scientific based. And I'm really worried about the health of people in our country today who are having this come apart, and I'm really delighted some of you are experts and we can get that right information and make sure that we share that with people. He fired the CDC, head of the CDC, like 5 weeks after they put her in charge. Why? Because she disagreed with what he was doing in terms of science-based information for people in this country. Meanwhile, we have seen NIH research be eliminated. I know of people who were on clinical trials who were cut off in the middle of a clinical trial. We have seen a lot of promising research get lost, including on the mRNA vaccine, which I hope people understand doesn't just impact vaccines, but there is groundbreaking research on cancer using mRNA technology that has now been stopped because of the actions of this administration. Meanwhile, in Congress, the Republicans passed their big, beautiful bill that is going to cut people off from Medicaid. Here in Washington State, we will lose between $31 and $51 billion over the next 10 years to make sure people with Medicaid have health care. We have about 250,000 people in Washington State that will lose their Apple Health coverage, and we'll hear about that today. Hospitals everywhere are sounding the alarm to me about how if without this reimbursement, they will be closing their doors, especially in our rural communities. This is called access to health care that we are losing and losing really rapidly. And meanwhile, the tax credits for the ACA are going to expire, so that means about 200,000 people in our state are going to be impacted. I know how distressing this is to everyone, so I am here to hear from all of you because we have to fight back. We have to make sure that people's real health care is taken care of and the years of progress we have made are not undermined. So I'm here today to hear what all of you have to say and to take that back to Washington, D.C. with me, and I really appreciate everyone here participating. So Esther, I think we start off with you, so
Sure.
Go ahead.
Thank you so much. First, I'd just like to say, Senator Murray, it's a real honor to host you. You know, we've worked together for a long time, but I don't know that you've been on
This is
site
actually the first time I've been here.
since
So,
I've
yeah,
been here.
Yeah.
Yeah, definitely. So it's an incredible honor to have you today, introduce you to our amazing team. We get to work with incredible people. I think that the thing that I really want you to understand is that the Seattle Indian Health Board is an urban Indian organization and also a federally qualified health center. What's really important to note is that when the ACA was implemented, it was implemented in a way that was designed to have Medicaid actually supplement the grossly underfunded IHS system. So a loss of Medicaid funds could be devastating to us. We've been finally able to kind of stand on our own 2 feet, implement creative, like culturally centered programs as a result of that third-party revenue. You helped us secure $5 million for our Thunderbird Treatment Center that will be opening up in early next spring. That's on Vashon Island. We're actually adding a clinic to that site as well, which by HRSA standards is technically considered a rural clinic. So I want you to understand that. I am very concerned about the Medicaid reimbursements for inpatient residential. As they were before, they're not very sustainable. I know that my CFO has been working aggressively to develop a performance that allows us to be able to sustain that work. But we're talking about a 92-bed residential treatment facility with 15 beds dedicated to serving pregnant and parenting people with meaningful and impactful services. So yeah, when I look at the Medicaid cuts, I'm just worried, right? Because we put a lot of effort into getting these services stood up, and certainly in the state of Washington and certainly in King County, these services are needed. We're losing generations of our babies to this addiction. The other thing I want to point out is that, traditional Indian medicine for us, we've talked about this a lot as well. We've been looking for third-party reimbursement for traditional Indian medicine. We're not one of the 4 states that were approved for that. But I think what I want the general public to understand is that when you take a culturally centered approach to healthcare delivery, you are going to have economic outcomes, positive economic outcomes, meaning we've had a 76% reduction in suicidal ideation for folks who access traditional Indian medicine if they were at high risk for suicide. Well, where does suicidal ideation land? It lands in the emergency rooms. Right. And if you want cost reductions in the hospitals, you have to invest upstream in things like traditional Indian medicine. Now, I do know RFK has an interest in traditional Indian medicine. He seems to really appreciate American Indian, Alaska Native epistemologies. And I think that this may be a good opportunity to really demonstrate that that could be useful. And I think it could be a bipartisan issue. And then lastly, I just want to reach a comment about 100% FMAP, right? 100% FMAP was the other reason we were able to secure the building on Vashon Island, because you helped us, along with Senator Maria Cantwell and Senator Murkowski, in a bipartisan fashion to get a 2-year pilot for 100% FMAP. And it resulted in $11 million that allowed us to purchase that building. We need to see more work like that. Because again, it results in cost savings. And I've added Abigail Echohawk to our panel today because Abigail and I function as close as you possibly can to co-CEOs. She leads all of our public health work within our organization, and frankly, public health is where I'm the most concerned.
Yeah. COVID exposed that the public health infrastructure in the United States has been crumbling at its best. And now with attacks on public health, we're seeing that even further threatened. However, we know that the strength of American Indian, Alaska Native communities is one that sustained not only our communities during COVID, but I believe we provided an example for the rest of the country. Right now, we know that American Indian, Alaska Native children are more likely to be hospitalized and die as a result of RSV, and yet we're continuing to see the research cut on RSV and access to vaccines. We also know that Native people overall have very low rates of vaccinations, and we're seeing as a result of the rhetoric going on right now that is focused on politics and not on science, that is increasing Native people and their hesitancy on getting vaccinated. So our Tribal Epidemiology Center, the Urban Indian Health Institute, is doing what the federal government right now honestly just isn't doing. We just launched a campaign last week in cities across the United States with urban Indian health organizations that is promoting vaccines and getting people to go to these urban Indian health programs. We are providing the only resources culturally tailored for American Indian, Alaska Native youth to understand about vaccines and to trust not only the science, but the words of their communities. We are leading where other folks are faltering, and right now I believe that this country can look towards American Indian, Alaska Native communities, our sovereign right as Indian health service organizations, to follow the best science available and to ensure that our people get it. We are doing what is necessary, and we're going to ensure the health of our communities, and public health has to be part of that conversation, or we're going to see this nation as a whole begin to falter even more than we already are in ensuring the health and well-being of our communities.
So how are you dealing with the new recommendations that just came out on the vaccine?
So when it comes to the new recommendations, we are looking at what is the best available science. We also are right now in a state where our governor is part of the coalition across
Right.
Pacific area to ensure that we're able to follow the best scientific recommendations. When we look at the rights of tribal nations, they have the ability to do what is best for their people
Right.
as informed by the best science, and we are ensuring that is what's going to happen. And so again, we may have unique abilities, like here at the Seattle Indian Health Board, we vaccinated people at the age of 50 during COVID-19, where the state of Washington was doing 65, because our elders don't reach 65. And so we're doing what is necessary, and we're able to take our ability as Indian Health Service organizations and do what is best for our people as informed by the best science.
We
Good.
will continue to do that.
Good. Thank you. Thank you for doing that. All right. Doctor?
Well, thank you, Senator Murray, for convening this roundtable and for being a voice for science. In all my years as a pediatrician and in public health, I never ever imagined we'd be in a position that we are today, having to defend science. But here we are. And it's really unfortunate because for decades, our state and other states have had this partnership with CDC and other federal agencies that's been built on a foundation of science and transparency. And it's really sad to see how federal actions are dismantling this foundation brick by brick. The dismissal of top CDC scientists, the removal, as you mentioned, of all 17 members of the Advisory Committee on Immunization Practice. Really key policy shifts seemingly made without any input from subject matter experts who've devoted their careers to public health. It seems like every week brings some new instability and uncertainty and a step away from science-based public policy. So last week, for example, the ACIP issued recommendations on childhood vaccines that limit parent choice and decrease access, and they didn't present any new safety data to justify these changes. And these changes impact all families, but especially our most vulnerable families from low-income households who really rely on the federal Vaccine for Children's program for access to vaccines. And again, these were changes that were not based on science. And if there's one thing we know, it's that to be effective, public health policy has to be based on science. And when federal agencies can't be relied upon to do that, then it really becomes a responsibility of the public health system and state health departments and local health departments and tribes to step up and provide that leadership. And that's what we've had to do in Washington State. So when we saw that the FDA put new limits on COVID-19 vaccine, and that this was causing a lot of confusion and decreasing access to vaccine, we stepped up in our state by issuing a statewide standing order that clarified that everybody 6 months and older in Washington who wants COVID-19 vaccine should be able to get vaccinated. And so this provided clarity and also increased access, because we were hearing that many pharmacies were starting to require a prescription from their healthcare provider, and this is an extra step that wasn't required before. And so this new standing order can serve as a prescription so that people don't have to go through an extra step of getting a prescription. And I have to tell you, after we issued the standing order, we received so many emails and messages and voicemails of thanks, not only from ordinary Washingtonians who were relieved that there would be one less barrier to getting vaccinated, but also from healthcare providers who are wondering how they were going to generate all these prescriptions to ensure that their patients will get the best protection available against COVID-19 severe illness. And the other action that we've done, as has been mentioned, is with Oregon and California and Hawaii, we've set up the West Coast Health Alliance. And this alliance is really based on the principle that public health policy must be based on science, and that vaccine policy must be informed and aligned with policy from trusted medical associations like the American Academy of Pediatrics, like the American College of Obstetricians and Gynecologists, like the American Academy of Family Physicians, because frankly, the public trusts healthcare providers more than they do the federal government right now when it comes to vaccine policy. And I think the reason why we have received so many messages of thanks and support from ordinary Washingtonians is because they understand what's at stake if we move away from science. They understand that these actions that the federal government has taken aren't just abstract policy decisions, that every canceled grant, every new limit on vaccine access, every new decision that's not based on the best available science is a threat to the health of our communities. And so no matter what the federal government does, we, the Department of Health, want to reassure everybody in Washington that here in our state, public health policy will always be based on the best available science, because we know that that is the best way to protect and improve the health of our communities, and that's a principle that we won't compromise on.
So I really appreciate Washington State stepping up with California, Oregon, and Hawaii. Are any other states talking about joining the consortium at this point?
I haven't heard about other states joining the West Coast Health Alliance, but we have been talking a lot about how we can align with other collaborations. So the Northeast states have formed a collaboration. And we really want to find alignment, especially around the recommendations from national medical associations, because I think we all want to avoid a fragmentation of vaccine recommendations where different states and regions have different guidelines.
Right.
And so I think the more we can align, the more we can support and be informed by guidance from national trusted medical associations, the less we can avoid this fragmentation that I think we're all concerned about.
Okay, and the other question I had for you, because I get it all the time, is will insurance companies now pay for those vaccines because of what Washington State has done with this alliance?
The alliance itself won't directly impact insurance reimbursement for vaccines, but we're very encouraged. Medicaid continues to cover vaccines. AHIP recently said that they will that they advocate for the coverage of COVID-19 vaccine through the end of 2026. So we're very encouraged by these steps and hope that insurance coverage continues to be a facilitator rather than a barrier to vaccine access.
Okay. And the one thing I would just remind everybody, it's great Washington State is doing this along with those other states, but the fact is measles, mumps, rubella, RSV, they're national. So if other states are not providing vaccines, not having the same recommendations, it will impact our state as well. Yeah, so thank you. All right.
Thank you. Thank you so much, Senator Murray, for hosting this conversation and just your many years of leadership across tribal health, behavioral health, public health, and just so much more. I'm going to focus my comments on the issue that you mentioned regarding the extension of the enhanced premium tax credit. So again, for everyone in the room, my name is Ingrid Ulrich. I'm the CEO of the Washington State Health Benefit Exchange. I'm pleased to be joined in the room by our longest-serving member of our bipartisan board, Hiroshi Nakano. And our organization is truly the front door for both Medicaid and marketplace coverage. So through our portal, which many people might be familiar with, Washington Health Plan Finder, people can come in and determine their eligibility and get themselves and their families covered through these two coverage programs. We, and I think everybody in this room, we're really proud of all the progress that we've made in Washington State over the years. I think now, with all the threats coming at us, it's an important time to remember that pre-ACA, our uninsurance rate was nearly 15% in our state.
Yeah.
And through all we've done with the Medicaid expansion, with setting up our own state-based marketplace, we've pushed that down to less than 5%. So that's huge progress, and those gains are what's on the table. We're hugely concerned that the bill you mentioned, I will just call it HR 1, what will, with the deep Medicaid cuts and immediate harm to people who rely on our marketplace, will lose eligibility to any tax credits, including people who are lawfully present in this country, tens of thousands of them. I'm very concerned that we're going to go back up into double digits, and we know what that means for the whole system, for our healthcare system and our economy. So this damage that has already been done, put on the table with HR 1, has the risk now of being compounded by the next decision point before you at Congress that you are well aware of and we So appreciate your support for the extension of the enhanced premium tax credit. Let me give some context so everybody knows what we're talking about. Since the ACA, we've had a layer of tax credits called advanced premium tax credits that help to buffer the cost of health insurance for people based on income. For the last handful of years, those have been enhanced. That's been very important because health insurance is super expensive. So the people who come to us to purchase health insurance don't have it through their job, through a large employer. They're not eligible for government programs like Medicare and Medicaid. And so the individual market is the place that they can come to purchase health insurance for their families. We've seen huge price increases in our market year over year, the last handful of years, about 10%. And that's healthcare cost inflation, it's utilization patterns, et cetera. But now with this earthquake of uncertainty happening at the federal level, the approved average rate increase in our market this year for plan year 26 is 21%.
So when people get those bills, it's going to be 21% higher.
More.
Or
It's
more.
going to be sticker shock because there's only a percent of our customers, so 3 out of 4, or 216,000, are eligible for the tax credit, the enhanced level tax credit. So those 200,000 folks will receive, the overall increase is 21%, but in the folks receiving the tax credit, the estimated average premium increase net is 65%.
Because they lose that tax credit.
Yes,
Yeah.
yes. So the value, so the plans are, the price of a health insurance plan varies hugely based on your age, your income, your geography, and family size. But it can be as much as between $5,000 a year to $10,000 or more. So the economic value of these tax credits that you are fighting to have extended is an average of $1,300 a year across the market of the 200,000 plus people eligible, and $1,900, almost $2,000 is what it's worth for people who are 55 plus. Because of age rating, they have higher overall premiums. So that's the numbers, and our actuaries have looked at it and said, if this is not extended, we predict that 80,000 Washingtonians will come in to open enrollment, which opens November 1, and see price hikes so high that they will decide to drop. And that's where you see the story of our insurance rates going back up into double digits.
Because even though those people will no longer have health care insurance, they still will get health care. So the insurance companies have to average in people who are not paying, and everybody's prices go up.
Everyone's prices will go up. So this is not just an issue or a problem for people on Medicaid or exchange coverage. As we see an increase in the uninsurance rate, we see more demands on our healthcare system, longer wait times, all the things you're probably about to talk about, so I'll stop talking. So I want to close just with the people, because I've shared a lot of numbers. So what we've done at the exchange is put a call out to our customers. Federal change is coming. We want you to know changes are happening. And we interviewed a number of our customers who called back and said, I'm so concerned. Yes, I'd be happy to have you interview me and tell my story. So we have this storybook that I've already shared with you and your staff that highlights many of these folks. The pattern here is it's folks in our rural counties who are the highest percent impacted positively by the tax credit. It's small business owners, self-employed, and older adults, the pre-Medicare population, will be hardest hit by this change. So in the packet is a woman named Stacia, who is a skincare specialist. She's been running her own business for 30 years, doing facials and eyebrows and making a living that way and really excelling at it. And I won't read this whole thing, I'll just share a quote from Stacia. She says, I think to myself, wow, I get it why people don't go into business for themselves. And it's only because of the health care. I'm booked solid and I'm busy, but healthcare, it's the healthcare piece. I don't know if I'm gonna have it next year. And Stacia says she told us she's grateful for the Affordable Care Act, but worries about the increase in monthly premiums if enhanced premium tax credits go away. She noted to stress about trying to figure out which plan she would need in the upcoming year. And she says, it's scary to think that we won't even have that, which is not perfect. That's plans with the prescriptions she needs. But we won't even have the subsidy next year, she says. So I'm trying to get everything done this year to see if I can survive next year. So this is where folks are at with a lot of fear and concern and knowing what are they gonna do without coverage? They're still gonna access health care, and that's gonna be hard on our whole system. And as you know, Senator, the timing is of the essence. And so we thank you for working hard at this moment of what's happening in Congress. If there's no fix in the very near term extension, people will come in and they will see that sticker shock. If it's fixed sometime more towards the end of the year, we'll do everything in our power to switch everything up and get people the lower premium. But we will have already lost customers who just out of the fear of seeing that initial sticker shock.
Yeah.
So I'm so grateful for your work on this.
So what she's saying is right now in Congress, Democrats are trying to get the tax credit extended. But time is running out because people are going to get their bills on November 1st. And if they see them and drop out, then even if we get them extended again, they will already be out of the market. And that's just going to be a tragedy. So thank you.
And I will turn to Dr. Lynch.
Dr. Lynch.
Thanks, Ingrid. Good morning. Thank you, Senator, for inviting me to be here. Thank you to the Seattle Indian Health Board, our incredible partners. My name is John Lynch. I'm an infectious disease physician and clinician. I'm based at Harborview, just up the hill here. And we share a lot of our patients together. It's quite a privilege. I'm not going to comment that much on insurance and issues around that. It's not my area of expertise, but as a mission-driven hospital, Harborview Medical Center has its doors open to everybody, unconditionally. And I can definitely tell you that when, pre-ACA to enactment of the ACA, we went from what was called self-pay in the double digits, which isn't possible, right? None of us can afford medical care the way it is now without that insurance coverage, to low single digits. And the impact at Harborview was incredible. So I can't imagine a future without that. What I really want to focus on, though, is this issue around vaccines and infectious diseases. I spent my entire career fighting infectious diseases. I would love it if all infectious diseases went away tomorrow. I'd be fine with that. What I'm really worried about is what the future looks like around these infectious diseases, particularly vaccine-preventable infectious diseases. There are innumerable infectious diseases out there that impact babies, pregnant people, adults, older folks, or elders and similar, that lead to, immeasurable suffering and unfortunate deaths as a result of that. In many ways, we live in an incredible time in healthcare and in medicine, right? Amazing research is being done out there. It's being put into place in clinics and in hospitals and operating rooms that is saving lives, preventing human suffering and death. But at the same time, some of the things that are being targeted are those very same innovations. And I'm going to focus on things like vaccinations specifically. Vaccines are one of the most important tools that we've had in the history of medicine to prevent human suffering and death. When you think about stopping liver disease and death due to hepatitis B, that also stops liver cancer, a vaccine that stops cancer. Similarly, human papillomavirus, the HPV vaccine, prevents cervical cancer. It stops it in its tracks. No one has to suffer or die from that disease with that vaccine. You think about children, pregnant people, and other vulnerable adults dying from respiratory syncytial virus, as mentioned, RSV. We don't see Haemophilus influenza, H-flu, meningitis in children anymore, right? This disease, where in vaccinated population, is virtually gone. Measles, mumps, rubella, as the senator mentioned, chickenpox, right? The massive impacts on reducing flu harm and suffering, and COVID-19. But at the same time, vaccines and CDC's historical vaccine recommendations have kept all those groups safe. Babies, pregnant people, immunocompromised people. That's over 10% of our population in the United States. Adults of all ages, especially those who are older. Those recommendations historically have kept those populations safe, right, through vaccination recommendations. Vaccines eradicated smallpox, right, and for much of the world has ended plagues, right, that have permanently harmed or killed millions of people. And what we're doing right now is going backwards on those successes. And this will only lead to more Americans suffering and dying. What we're seeing today is an acceleration in an effort that's been sort of percolating for many years and actually decades in the United States to discredit everything that is amazing about vaccinations and to create confusion about who, when, and where a person gets vaccinated and who's going to pay for it, right? And that's what we're seeing right now. Earlier this summer, one of my colleagues who's pregnant came to me and said, John, should I get a COVID-19 vaccine? I said, absolutely. The next day she went to a pharmacy and they said no. She went to another pharmacy. They said no. She finally had to get an appointment with her doctor to get a prescription sent, which went to the wrong pharmacy, right? And that's all friction that will eventually lead to people not getting vaccinated. And those people will get infections, they will suffer, and sadly, tragically, awfully, some of them will die as a result. So last week's ACIP meeting, to build on what Dr. Quanget mentioned, is an example how misinformation is now being systematically built into what has been all the recommendations we look at. As an infectious disease doctor, I go to the CDC recommendations to look about how I should take care of some infectious diseases, how to assess risk in certain populations, who to vaccinate. And I give this information to my primary care providers, my pediatricians, my obstetricians, and all these other folks out there who are now wildly confused about what to tell their patients, what they need to recommend, because those guidelines can no longer be trusted, in part because of this newly reconstituted ACIP panel, which is using misinformation and spreading disinformation and discrediting what has been a historically incredibly important and central part of healthcare in the United States, the CDC. And I'm very worried that that damage is irreparable and is an emergency. It is important now more than ever to go back to where the science shows us these tools are effective. These vaccines are safe, they are highly effective, they are life-saving, and they are one of the most important tools to keep all our families and our communities, importantly, because you got to remember, vaccines not only protect the person, but protect everyone around them, and that's a piece that's often missed, right? These vaccines keep us safe, and we got to go back to the science that supports those, because confusion right now is what's being manifested out in the community.
Are you seeing a lot more confusion and among patients saying, well, I don't know if I want to take that because I heard this or that? Absolutely,
and I think that the issue is that it's rational. Why am I getting this vaccine? I feel good, right? I take care of myself, I eat, whatever. And those questions are very reasonable. The problem is now we could always say, hey, yes, as a physician, I've read the material, I've read the science, I feel very confident in this recommendation. We have a national guideline from the CDC, right? This incredible organization backing me up. And now we don't have that, right? Where do I look to back me up, right? As opposed to saying, well, John Lynch said so. I'd much rather have someone, these incredible scientists and public health professionals being able to back me up.
And they're gone.
And they're being, systematically just taken apart.
That's why I'm scared. And we all should be. So thank you very much to all of you for outlining what is going on. And clearly we have to step up as citizens everywhere and say, enough. We've got to stop this. And I know I'm doing it, trying to get as many people to as well. And this has been really helpful. So I appreciate everybody being here today and outlining what's going on. And I want to open it up to any of the press who have any questions.
If you have any questions, just say your name out loud. Hi, I'm Elise. I'm with Seattle Times. Thank you all for being here. Senator Murray, can you give us an update about the OIG independent review that you asked for regarding RFK's decision to fire Dr. Menarez? Can you give us a little context about that?
Right, so I've requested an OIG investigation into the firing of Dr. Menarez at CDC. She was confirmed by the Senate and 5 weeks later fired by RFK Jr. And she has told us, she came before our committee, that was because she would not allow RFK Jr. to predetermine what the outcome of ACIP was, the healthcare. He has told a very different story to the Finance Committee. We need to know what went on there because it's not just important about her, it is about who they put in place behind her so that we can restore the trust and get confidence back into the decisions made by the CDC. And I am deeply worried about where we're headed right now.
Have you heard any
No,
update
don't.
on that investigation?
How is it looking in terms of extending the tax credits?
So right now, the Republicans are refusing to extend the tax credits. Democrats have made it very clear that as we get to the end of this government funding period in a few days, that we want to have a conversation with our Republicans, with the Trump administration, about how we can get these tax credits extended. So far, the president said he doesn't need to vote, he doesn't care what we say, and the Republican leadership has said they don't need to talk to us. That to me is just really disheartening. It is not how Congress has ever worked in my knowledge in the 30-plus years I've been there.
know at this point, well into September, what DOH is seeing? How are some of the, we've heard some challenges about pharmacies being out of stock, about individual pharmacies still not understanding what the standing order is, how to bill for it. What are you hearing from DOH about how some of these issues may have gotten resolved or might still be continuing?
Yeah, thanks for that question. Well, we've received a mix of input. On the one hand, we've received a lot of thanks, as I mentioned, from ordinary Washingtonians saying that they are able to get vaccinated at the pharmacy where they could not before. We're hearing from our pharmacy colleagues that they're able to get many more people vaccinated since the issuing of the standing order. But we also are hearing that people are still facing barriers, and that's because vaccine access is a very complex issue. It not only involves guidance, but also insurance coverage, people getting to the pharmacy, people having a prescription, and having the pharmacist align with that prescription and fill it as written by a healthcare provider. And so all of these pieces need to be in place for people to get access to vaccines. And so the standing order is just one piece of this puzzle. But pharmacists have been incredible public health partners, and many people have gotten vaccinated at pharmacies, and we know that many pharmacists have always stepped up for the health of the communities and will continue to step up for the health of their communities. And it's understandable with all of the confusion that the federal government has injected into vaccine policy, that many healthcare providers and pharmacists on the front lines are confused. And so we issued the standing order in an attempt to provide some clarity and to increase access. And it's understandable that there is this transition period, because it's a big step. But we know our pharmacy partners are really committed to increasing vaccine access, and also there are supply issues that we also are worried about too, that none of us have direct control over. So, I guess the other thing I'll mention is that historically, whenever a new vaccine has come out, there's been a transition period when supply isn't quite where we want it and doesn't match demand. And in the past, that evens out over time. And so we're hopeful that will happen this time as well.
What is the state of our vaccine supplies? And I'm talking about like COVID boosters, for example.
Mm-hmm. Well, one barrier is that CDC has not yet opened up vaccine ordering for the public supply of vaccines. So many clinics are worried that they won't be able to order and receive vaccine quickly to give their patients vaccine. And so we have been advocating for the CDC to open up ordering as soon as it can. And we are also, our immunization office is also setting up mechanisms for clinics to pre-order vaccines. So as soon as orders do open up, the orders can be finalized and processed as quickly as possible.
I'm sorry, can you explain, so when you say the CDC has to open up the orders, this is for the public?
Correct, yes.
Okay, so as far as public clinics go, the supply isn't quite flowing yet?
Correct.
If I
Yes,
understand
correct,
it
it's not
correctly.
flowing, correct.
Okay.
So the vaccine that's available is on the private market, and we are waiting for vaccine to be released by CDC and for ordering to open up for publicly available vaccine.
Dr. Kronga, can I add one piece of
Please.
information related to this question? So earlier we had a question about insurance coverage for vaccines in these standing orders. Is my understanding from the Office of the Insurance Commissioner, Patty Cooterer, that the markets that we are state regulated by our insurance commissioner, including the individual market, which I was speaking to, as well as the small group market, have been ordered to follow the recommendations of the multi-state alliance, and will be required to cover the cost of these vaccines for the members offered through the insurance carriers in those markets.
Thank you all very much, and thank you to my panel.
Thank you, Senator.
We're gonna do a group photo right there, so we're just gonna move